for London.
Neil from London Hems. It's a 25-year-old male, cyclist versus HGV. His code red, and ETA via air to the pad is 15 minutes.
What have we got coming? So London Hems are bringing us a 25-year-old male, cyclist versus HGV, code red. Okay, and where do you want to put him? Put him in Bay 8. Okay, yeah. And how long have you got? 15? 15 to the helipad. Should we put the call out now? Yeah. Okay. Great, thanks Nick. Through the pre-arrival checklist. Yes. Okay. So nurse in charge contacted you, consultant informed me. Have we requested trauma pack?
Yeah, it's on its way.
Trauma consultant contacted through Switch. That's been done.
Yeah.
Radiologist has been informed and is coming down. ICU consultant has been informed is coming. Ultrasound is switched on. Bloods and imaging are being requested now.
Yeah.
Trauma line is set up.
Yeah.
12:20 and theatre coordinator informed.
Yeah, and theatre 12 will be ready if we need it.
Brilliant. Transfusion PACO requested.
Yeah,
and we've
on the way
declared
down
code red.
Yeah,
okay,
done.
fantastic. So everyone will be here in a minute hopefully. Okay, thanks. Guys, just before the patient arrives, could everybody just state their first name and their role? We'll go round to my left. So I'm Anne, A&E consultant team leader.
Vish, orthopedic registrar.
Sarah, radiographer.
Mariam, surgical registrar.
Will, ED registrar.
Javaria, radiology registrar.
Queenie, ITU registrar.
Harriet, primary nurse.
Babe, Belmont nurse.
Heidi, orthopedic SHO.
Nick, surgical SHO.
Pretty theatre nurse.
Karen, theatre nurse.
Brenda, EDA assistant.
Nikki, nurse in charge of resus.
Okay, has everybody had a chance to read the action card? Most of you have set up your equipment. Is there anything missing that you need to be able to perform your role? Okay, good. So the story is, this is a patient coming in with London's Air Ambulance, 25-year-old male, pedal cyclist hit by HGV. They've declared a code red and they've already given at least 1 unit of packed red blood cells. So I think we've got everything out that we need, but the plan will be to do the primary survey, immediate chest and pelvic films and a fast. We'll then make a decision based on stability about whether we can go directly to theatre or whether we have a window to go to CT. Queen, are you happy with the airway? Okay, thanks Neil. Ready for handover?
Alright, good morning all. This is Matt. He's a 25-year-old male. Approximately 1 hour ago, he was a cyclist versus HGV. He was GCS 15 on scene, moving all limbs. Injuries head to toe, no concerns with the head and the chest. Significant bruising over the abdomen and a closed open book pelvic fracture. Interventions, he's had a 111 RSI with a rock time of 9:56. And he's had 1 gram of tranexamic acid. He's had ongoing volume issues. He's had 2 units of blood en route, and his last systolic blood pressure with us was 85.
Okay, that's great. Thanks, Neil. Okay, guys, can we have 3 people either side? Trolley perhaps down a little bit and both sides down. So we're going to lift him. Okay, we're going to lift the scoop about 6 inches on Queenie's count, and Vish will pull out the blizzard blanket.
Okay, brace on my command. Ready, brace, lift. Ready, brace down.
Okay, head blocks and tape off and scoop broken, please.
Broken at the bottom.
Broken at the top.
I'm bracing from the patient's left-hand side, first of all, on Queenie's count.
On my count. Ready, brace, pull. And again, ready, brace, pull.
Okay, well done, guys. Right, can we have primary survey and bloods, please?
Temperature 35.
All right, the trachea is nice and central. There's no obvious open chest injury, no surgical emphysema. The chest expansion is equal bilaterally. Percussion resonant bilaterally. Breath sounds equal bilaterally. There's obvious bruising on the anterior abdominal wall.
Okay, good blood taking, well done. That's great. Can we run that gas, please?
Okay. Here for chest X-ray, please. In 5, 4, 3, 2, 1. Thank you.
Okay, that's great. Guys, at the moment, he's got a blood pressure of 84, his end tidal is 4, and we've got a heart rate of 100, so I think we're probably in a situation, unless the fast is positive, that we can probably go to CT. So if we can get prepped for that, we'll get the fast done, and then you have to pop a central line in, please. Thanks.
The fast scan now, please. Thank you.
Okay.
Hands over
Do you mind if I do this fast scan?
Sure, go ahead.
Great.
in 5, 4, 3, 2, 1. Thank you.
Okay, I'm performing the fast scan. So looking in the right upper quadrant, no free fluid. I'm now looking in the left upper quadrant. No free fluid. I'm looking down in the pelvis. I can't see any free fluid yourself. Okay, we're just going to have a quick look in the sub-Ziffy window. And I can't see any hemopericardium. Okay, so in summary, this is a negative fast scan.
Thanks, Will. Okay, great. We'll just get the pelvis on the...
Thank you. Okay, the chest x-ray, tubes in an adequate position, and on the left side of the chest we have rib fractures and a pneumothorax. So, Nick, would you prep to put a chest drain in, please, just before we go to CT? We've got a couple of minutes. Mariam, are you happy to support him? Thank you.
Hands clear for pelvis. 5, 4, 3, 2, 1. Thank you.
Okay, that looks like a complex right-sided pelvic fracture.
Okay, so that's great. Thanks, both. Are you happy if we do CT head to pelvis? I think that's probably okay for now. And if we might need IR, so can you just let the interventional radiology team know? Is that right? Thanks. That's great.
Okay, guys, we're ready to go to CT. Everyone happy to move?
Yes.
Let's go.
So we're going to log roll him 10 degrees gently on my count. Ready, brace, roll. Thank you. And onto the blue. Ready, brace, slide. And on the blue, ready, brace, slide. Thank you very much.
Okay, let's just check what number.
So his blood pressure's dropping off a little bit.
Yeah, he's become more tachycardic.
Okay,
BP 70.
That's head and C-spine done. We can go back in if we need to.
Okay, guys, I think we should give him 250 mils of packed cells to start with, and we've got the plasma up, so the second bolus will be plasma if we need to give it. But can we start with that? Is that okay, Queenie?
Yes.
Thanks. Okay, let's just carry on and do the body scan though, so that we get a diagnosis and we decide where we're going to go, but we'll transfuse him whilst we're waiting. Yeah.
There's hemoperitoneum, particularly on the right-hand side, and also blood related to the complex pelvic fracture that we've seen on X-ray, which is right-sided, involving the acetabulum and the ilium.
Quite nasty.
And it looks like a nasty fracture, and the remaining solid viscera are normal in appearance.
Hemodynamics then?
They're about 9. His systolic of about 90 when he came in, having had 2 units of blood with HEMS, but he's just dropped his blood pressure just after we did the CT head, so he's having pack A at the moment, so he's had another further packed red cell and a unit of plasma as well, so he's less stable than he was.
Great.
And he's got a lactate of 3.6 and a base deficit of -8, and that's before he dropped his blood pressure.
So yeah, given these findings that you're showing us here, I think probably the next best step is to go to theatre. We can do pre-peritoneal packing and do an X-lap too.
And we've got a pack B on order.
Yeah. Okay.
And we're going to theatre 12.
Okay, great. Thanks, Rosanna. Okay, so we'll just go through the exit checklist before we depart. So we are going to go to theatre 12. Do they know we're coming? Yes. Okay. The planned procedure is pre-peritoneal packing and exploratory laparotomy.
Yes.
We'll just go through the checklist. So name bands times 2.
Yep.
Oxygen supply connected to the patient and tank sufficient.
Correct. Yeah.
Airway secure.
Yes, it is.
Breathing and ventilation adequate.
Yes, it is.
IV access well secured.
Yep.
We've got blood products, pack A and the real-time log.
Yeah.
Monitor is attached. We've got a transfer bag.
Yes.
Suction unit on the trolley.
Yeah.
Emergency drugs.
Yes.
Do we need any special kit? No. Transfusion, have we told them that we're going to theatre 12?
Yeah, they know that we're going to
Great. Have we got the priority 1 card for the lift?
Yeah.
And the porters have gone ahead to get the doors?
Yeah.
Brilliant. Okay, we're ready to go. Again, if the whole team can come, we'll hand over in theatre.
Yeah.
Thanks, everyone.